Morning, Mr. Chair, Commissioners. I handed out just the usual numbers that we are watching, of course, daily. This is the numbers from May 4th. They will change at about 11 o'clock every day. They update those on the website. So as you can see, the Minnesota cases are 7,234 to date. Those are positive cases. And our Clay County positive cases are 190. So they continue to go up a bit, and we'll continue to see the rise because of the testing. They're able to continue the testing, so we'll see those numbers increase. We haven't seen a decline or that leveling out yet. The Minnesota deaths are 428, and then the Clay County deaths are 13. So when you see the number of tests completed, there's been about almost 86,000 tests. And you see the number of cases, so we're still at about 8% that are positive based on the number of tests, but they'll continue to, we're seeing a number of asymptomatic people as well, because we know that the asymptomatic spread is out there, the community spread, and that just means you can have the virus and not have the symptoms. And so they recognized this about a month ago, so people can carry the virus before they even develop the symptoms. So
where are the tests being performed? I mean,
the tests in Minnesota are at the state health lab. So the Minnesota Department of Health lab, I've got the number there. They have done about 13,000 tests. And then there's other external labs that they use. And about 72,000 of those are from the external labs. So the state health labs, both the state health lab in North Dakota and in Minnesota, they just can't keep up with the number of tests. So they use external labs. Mayo Clinic is one of them.
I mean, where do we perform taking the tests? Or
so
has
in
Clay County done anything like that?
In Clay County, the testing is done through Sanford and Essentia. So those health systems are doing the testing. Public health, local public health departments do not do the testing. So the testing is done through the healthcare systems. So the majority of our cases are our residents in Clay County. They are utilizing the testing that is done through Sanford and Essentia.
Okay, so like when they had it at the Fargo Dome last week, can Minnesota residents go over there and get that tested?
Yes, correct. That was based on, they had a little bit of criteria, but the residency wasn't one of those criteria. So those that were exposed to a positive case, that was one of the criteria. You could be from Minnesota as well to go through that testing.
So, okay, so if you tested over there and you test positive, are you a North Dakota positive or are you a Minnesota positive?
Well, you are Minnesota positive. The test results would come through whatever lab they're using, the North Dakota Department of Health lab. They also use other labs for testing, so the testing results would come through that. And if you're a Minnesota resident, will receive that test result. Minnesota Department of Health will receive the test result as well as the individual, and then Minnesota Department of Health will follow up on that contact tracing.
Thank you.
So
Yes.
that positive would be included in this number?
Correct.
So
Yep.
then if I'm a Clay County resident and I succumb to COVID at a Fargo hospital, am I included in Fargo death or North Dakota death number or in this number?
You'd be included in this number. Yeah, so it's based on your residency and where you're a resident of. Yeah, good questions.
So, just to follow up to our chairman's question, so those tests that were performed through North Dakota Public Health at the Fargo Dome, there had to be criteria to get in line.
That's correct.
And was that criteria developed through contact tracing?
No, that was just the criteria they used for who they wanted to test.
So anybody could drive up there and say, I think I've been in direct contact with somebody, and they would test them?
Correct.
Okay.
Yes, and that was through the North Dakota Department of Health.
Right.
That did the testing, and
Right.
they of course did testing again on Sunday, and then they canceled.
Ran out
it.
of tests or something?
Well, they didn't run out of tests, but the lab, the criteria that the lab needed and the equipment they needed for completing those tests they were way backlogged. So it wasn't that they ran out of swabs or the reagent, it was just at the lab that they had some challenges keeping up, so they really had to, they weren't able to get through all that test at the lab. So that's why they had to cancel that Monday testing.
Well, probably I'm not keeping up completely on it, but I guess I really wasn't aware that Minnesota residents could go through there, you know.
And some of that information wasn't out as, it wasn't put out way ahead of time for people to determine that. So
I guess
it
I'm
was-
just concerned that our Clay County residents aren't aware that they can be tested.
Right, and some of that is, and that's all through the North Dakota Department of Health, so it's, you know, we don't even hear about it, and usually ahead of time as well, so
But
that is correct. The information doesn't always get out there that Minnesota can be part of that as
Well,
well.
that's why I'm asking, is Clay County gonna do anything?
Oh, you're asking about Clay County?
Well, I mean, because I wasn't aware that I could go over there and get tested.
You
So when is my
could
chance?
if you met the criteria, just the general public. They weren't taking anyone and everyone. You had to meet their criteria. So one of that is if you were in contact with a positive case, for instance, that was one of the criteria. So you as a general citizen that had no contact with anyone, or you're not a healthcare worker, you would probably be turned away.
I thought that the one on Monday that got canceled didn't have as many prerequisites for the test.
Yeah, I didn't see the Monday, what the criteria was for Monday testing. I did not see
So
what
my
that
question is, if I'm interrupting anyone, I'm sorry, but you hear our governor talking about increasing the tests for Minnesota residents. Where is Minnesota Department of Health doing mass testing on the western side of Minnesota?
Yeah, Minnesota Department of Health currently wasn't doing mass testing. The healthcare facilities were doing the testing. Now, I have been in contact, we're almost in daily contact with Minnesota Department of Health, and we're talking about testing facilities that are at higher risk. So long-term care is one of the areas where we're seeing more hotspots, the vulnerable populations. So they aren't inclined to do kind of a mass testing like North Dakota. The difference, of course, is population for one thing, but more importantly is the mass testing of those that are more vulnerable. So we're in conversations about how could we accomplish that, at least I'm in conversations with how could we accomplish that in Clay County. So I just had a conversation yesterday again with Minnesota Department of Health. Could we do some testing in our long-term care facilities, which have more cases, and also our homeless population? Those are the two biggest, most vulnerable populations we have. So at this point, I don't have an exact answer yet from Minnesota Department of Health. So they're taking it up to the State Emergency Operations Center, but I anticipate that we'll be doing that hopefully sooner than later. My push is that we get some of that done.
And I appreciate that. It just, you know, and I apologize if this comes off as harsh, but I think Minnesota Department of Health is doing the best that they can, but I'm really concerned that western Minnesota is kind of getting the shaft of that in terms of, if you look at a map, based on our population, Clay County is a hot spot.
They are.
I mean, we really are, and our nursing homes and skilled use facilities are now facing shortages of skilled care and CNAs. And in order for people to go into those, we probably should have those people tested to make sure that they can work. I think it will be vital to get more people tested so we as a board can figure out how we safely reopen the economy of Clay County. And so if it means that we need to champion having more testing, what can we do to help? It just seems like Minnesota Department of Health is tying the hands of counties that really want to help with the solution.
Right.
Well,
This goes
Sorry.
back to the, I'm sorry, this goes back to the comment that we talked about last week where we can't sit and depend on Minneapolis, St. Paul to be taking care of Clay County. I fully agree with Commissioner Mojo's comments on that, and
but just so you know, I am working very diligently to make this happen, and they're all hearing me.
And I'm not saying that you are not.
Yeah.
But just for the public's perspective, this board
Yeah.
took an action to do whatever we could with funds to make sure there was a local entity making those contact tracing connections. And Minnesota Department of Health said, we're not there yet, we don't need that quite yet. And so what can be, it's not
Yeah.
you, I'm not saying that
Yeah.
it's you.
So I can speak to the contact tracing. That's different than testing. So
Right.
we're talking about two different things.
Yep.
The testing is if we can swab, basically, we have swabs and reagent. If we can do the testing of people in those long-term care facilities and the vulnerable populations.
Yeah.
Now, just as a reminder, the testing gives you just a moment in time.
Right.
So you're testing today, that gives you what your results are today. You might catch some positives.
And you get the results 4 days later or 3 days later.
Well, the results, though, aren't the problem with Minnesota Department of Health. It is the labs. So when you send those,
Right.
there's only certain people that get the 90-minute test, and those are, of course, the most critical are the healthcare workers, and they
Right,
should
good,
get the
yeah.
90-minute
Yes,
test. They
yes.
need that. They're working directly with COVID patients, and so they need to do that. And they're doing that with those that are working with COVID in long-term care. The testing is not the Department of Health's leg. The testing is the lab. So for instance, we've been doing some calling around, checking with some of our positives. They're getting notified same day.
Good.
So as their test results are, so they've really ramped up and they're doing a better job because of their more manpower. But the testing results, and we just contacted someone yesterday, they got the result yesterday, and Minnesota Department of Health contacted them yesterday. So actually, they're doing same-day contacts. That's pretty great. So it's much improved. So the contact tracing is just that. So if you have a positive case, somebody with experience, so right now, the experience has to be public health, or epidemiology background or infectious disease background. You can't just use anyone because there's so many variables and so many questions. So if you use those that are not having any experience with infectious disease or epidemiology, it's double the work because they have to go back to the officials and say, okay, this is the question they had, what about this? So that's who they're hiring in Minnesota Department of Health. I do have a list of some people that could participate when we do that, if we do that. We did fill out a survey, so that results are back at MDH about do we have the capacity, how many do we have that could potentially be in that first tier. That would be our first tier category of those that have the experience to do the effective contact tracing. So that's where that's at right now. The testing is a separate thing, and those that can do the testing are the Minnesota Department of Health, North Dakota Department of Health, and then, of course, the healthcare facilities. Just like we're seeing in our area, it's Sanford and Essentia right now that are doing the testing. And it is about 2 to 3 day lag with the testing and the results. That's just the reality, both in both healthcare facilities and also at the state labs. Now, they have their criteria of who is the highest need and highest risk to get those 90-minute tests. And those people are getting tested that are working directly with COVID cases. So that's an important piece to know. So they are doing the best. Local public health is not responsible for testing, nor will we ever be. And contact tracing may come if Minnesota Department of Health gets backlogged again.
Yeah.
So they're so far been able to keep up.
I'll go back to my original question as far as being tested and stuff like that going. And you said they determine whether you should be tested or not. If you're permitted to go to the grocery store, and I go to a grocery store, pick up my supplies, and I feel I was in contact with somebody, who determines whether I was in contact with somebody or not? Do they get to determine that, or do I determine that?
No, the health department, excuse me, not the health department, the medical facility, so you'll call Ask a Nurse, and you will ask, because you aren't going to just show up to the emergency room, so you need to call ahead and
Well, what
ask.
if I just go over to the testing site?
Oh, if you go over to the testing site, they'll screen you. So they're screening with all the testing
Well, if I
sites.
say I was at the grocery store and I thought someone was coughing, do I get to be tested?
They will determine your risk. So they'll ask you more questions about that, and they'll say, No, you're in kind of a low risk right now, so you're not going to be tested. They'll determine that. We'd love to test everybody.
Well,
If
that's
we
what I'm
could,
looking
we'd
at.
test the entire population, but that's not where we're at right at this point. So
Okay.
they'll do the screening. So those that, if you go through the drive-through, they'll screen you, and they turn people away because they haven't met the criteria. And they could turn you away at the Fargo Dome when they did that testing as well. So those screeners will screen you.
Mr. Chair,
Go ahead.
can I do a follow-up to your question?
Go for it.
So we understand now that Sanford and Essentia are the ones responsible locally for testing. And when I say locally, I mean maybe the region that they cover,
Correct.
right? Because it is more than just Fargo and just Moorhead. It could be any place in Clay
Right.
County.
Right.
And so one of, our own chairman of our board just said a few minutes ago that he had no idea that he could go get in line at the Fargo Dome. And no discredit to our chairman, but we're involved with this. And if we don't know, as a Clay County residents, that we qualify to get in line for the testing when they do these at the Fargo Dome, how in the world is any other resident of Clay County going to know they can do that? So I think what our chairman was getting at is what can we do to, when they do that, to ask the media, for example, because it was all over the media that they were doing this. And why can't part of that be, okay, Clay County residents, you qualify for that too? Why can't that message be shared so that our residents know that a river doesn't divide this testing, because we're dependent on those facilities on the Fargo side or North Dakota side?
And just so you know, that's through the North Dakota Department of Health.
Right.
I will just say this, even North Dakota local public health was not aware of when they were going to start that.
I-
So the communication didn't happen even on
I
that side.
don't want to put blame to anybody,
No,
Kathy.
no.
I just
Right.
want to recognize where
Right.
there might be inefficiencies that can be improved
Yeah.
and how we can go about it.
Yeah.
I don't want to point fingers about the past, but moving forward,
Right.
I want our Clay County residents to be informed as to when those tests are happening in a public drive-through, that it's equally available to them to go to.
Yeah.
It's really simple.
And we've sent that message.
Okay.
So just so you know, we'll see about the next time if we get notified or not.
I just am not quite sure why the state public health offices, both of them, are operating with such a lack of local involvement.
That's right.
And local input. It just does not make sense on any, it's almost like, okay, local resident, Minnesota Department of Health is not doing mass testing in western Minnesota, you can be covered by North Dakota Department of Health. But then the local public health office doesn't really know what's happening. I mean, this is,
We've addressed the communication gap almost on every call that we have. So there's certainly, there's been some frustration expressed, and so they're fully aware of that communication gap, so,
and I understand that this is unprecedented, so I get that.
yeah,
But when we
Yeah.
are all trying to be part of the solution,
yeah.
there comes a point where you need to outsource some help and say, we need a little more local involvement, because the local involvement is there and ready to help, so.
Well, we're very involved, just so you know, locally.
I know you are, but what I'm saying is, the state is not allowing you to help with some of the things that they need help with.
Well, they don't, the testing is never going to be local public health, so that is not going to be a local thing at all. It's going to be the state health departments and healthcare systems, like the Sanford and Essentias. So that we cannot help them with. Contact tracing, so far they're up to date on that. We're doing our local communication with our vulnerable populations. We're still communicating daily with information from our local congregate care. We have about over 2,000 people. When you think about, that's a huge amount in congregate care. So that's assisted living, long-term care, corporate foster care, and we're really communicating. So locally, we're doing a lot of work, but the testing piece will never be what we own. That'll be always a state health department or healthcare systems. Public health will not be doing the testing. Contact tracing, we put in they did the survey, so we put our information about what our capacity would be for our first tier. So those, like I explained, with the highest levels of experience with contact tracing. So we can be available for that.
The frustrations we have as a board, and again, it goes back to you, and you said it, it was the North Dakota Department of Health that sponsored, along with, I think they had the assistance of the National Guard.
Correct.
To do the testing at the Fargo Dome. Why in the world can't the Minnesota Department of Health do something similar and sponsor something similar in Clay County when we are a hot spot? I think that's kind of what Commissioner Mojo is getting at, is why aren't we promoting something like that and doing something like that in the northwestern part of Minnesota? That's a frustration, and I'm directing that, not at you, Kathy, but I'm directing that at the Minnesota Department of Health. And this goes back to why we made the motion last week to be willing to do the contact tracing locally. All right, so let me ask you something going to that. So I learned yesterday of somebody who found out yesterday morning that they tested positive. So that test result, when they learned that I didn't talk to this person or question it, but did that result come from the state of Minnesota Department of Health? The results of the test?
Well, depended on where they got tested.
Okay, well,
if they got tested-
I mean, it sounds to me the only place they can be tested is at Sanford Essentia because, because it was a Clay County resident.
Right, and so Sanford and Essentia use their own labs.
Okay, so they would notify them, not the Department of Health, State Department of Health.
They notify the individual.
Yep.
That's the first call that the lab, when the lab results come in, and then they get
Okay.
sent back to that
Okay.
facility. And then that health department will contact, so North Dakota Department of Health that gets that results will contact Minnesota Department of Health.
And so this is the sequence that I'm looking for.
Yeah.
So when does that sequence happen? When did that person who found it, when does the Minnesota Department of Health get the results of the test of this individual in Clay County who tested positive yesterday morning? When are they informed of that?
Sometimes they say they get it same day, sometimes they get it a day later.
And so if it's a day later, when does the contact tracing start?
Well, just like I mentioned yesterday when we did some random calls, they were called the same day.
Okay.
At the individual. So they were able to get the test results to that Minnesota Department of Health, and then Minnesota Department of Health in turn called them.
So I guess my point is that this person who was tested had no symptoms. So the person, because you have no known symptoms, you're asymptomatic.
Correct.
Right? And so that asymptomatic person had the person not been tested, walking around and can be spreading the virus.
Yeah. There's many people walking around that
Right.
can spread the virus. Many people. We'll see more and more asymptomatic positives.
And that's why the
We should be
contact tracing
tested.
that's why we need to get on this.
Yeah, the contact
Locally,
tracing,
not by Minnesota.
but more the testing.
Yeah.
Commissioner Campbell, I think you're thinking more of the testing. It's two separate things. So the testing is important. That's important to get the asymptomatic people. But again, they're not doing mass testing. As you saw with Governor Walz, he said the increased testing was hoping to hit 20,000 a day. That's how many people they wanted to be able to test in Minnesota. They're trying to ramp up, of course, testing in North Dakota as well.
So
their
where are
goal
those
is to do
20,000 a day being tested?
Yeah, that would
Because
be
they're not
through-
being tested in Clay County.
Well, that would be throughout the whole state in Minnesota. That'd be the testing.
But
And remember,
we're depending on ours to come from Sanford and Essentia.
Right, that's where the testing, well, that's where the testing is, correct. Yeah.
I just see that, you said there's around 2,000 people in nursing homes and assisted living, you
Yep.
know? And I've got no percentages, but I think you hear 80-90% of people that are dying are from, I don't know, are from assisted living or
Long-term care.
long-term care.
Yep.
So can't we just go test all those people in there? I mean, we're talking about 2,000 people. Can't we test all of them?
Well, that was my request, is that we hit the long-term care facilities in
Okay.
Clay County.
Like, I'm not trying to blame you, Kathy, on all this. I'm just trying to
No, none
find
of
out,
us
why
are.
are we putting an effort out? We know where,
Yeah.
you know where it's at.
Yep,
We already got that
yep.
place. You know, they're in long-term care. Let's test those people.
My point is that our fatality rate for positive cases in Clay County is almost 8%. And if you had anything with a fatality that was almost 8%, we should be pushing harder. And that's why it maybe comes off that I'm being quite pushy, but I think it's ridiculous. I mean, I really do, that we have, I mean, Minnesota Department of Health won't tell us where they are. You can do the math. If you have 13 deaths in Clay County and 90% of them are in congregate care, which if you follow the state average, and they're only saying technically that 2 congregate care facilities in Clay County are positive. I mean, there's a lot of gray information that's not being let out, and as a public official, that's disappointing.
And Minnesota has the privacy data where they don't allow that.
But then
And-
why do they have those congregate care facilities listed on their website?
Yeah, they have those congregate care, but they will not release the numbers, so.
Right, but there's another facility in Clay County that has had losses because of COVID-19, and it's not listed on there.
Yeah, and they won't list all of them. They will
But-
also not list the ones that are 10 or less, so those will never be listed, but that's part of their privacy data.
Okay.
That's a Minnesota privacy data thing. It is different than North Dakota privacy data, so it's much more stringent.
It's just, from the outside, they're picking and choosing what they want to call as privacy data.
Yeah, just numbers can't be released in any facility. So that's the frustration. I know for, the board, and for us personally, it's also frustrating because we can't release those numbers. So, yeah, I mean, there's lots of challenges with this, and there's no doubt, it's frustrating because we know we need testing, and we know that will tell us, that will give us a bigger picture about what is going on, particularly with asymptomatic, as you mentioned, Commissioner Campbell, so.
Yeah, Mr. Chair, can I request one thing on?
Sure.
Thank you for this information, by the
Sure.
way, that you bring with you. It is helpful. I think what would be more helpful to compare this to something, maybe like a weekly trend.
Oh,
So
I
so
can
when I
bring
look
that
at the
to you.
purple box, unless I go back and pull out some papers, what was it last week?
Sure.
And what was it,
This is Clay County, right, on the back?
On the back is Clay County cases, so the total cases in
Yeah,
the blue.
but I guess what
Yeah.
I'm talking about, just
You wanna see
for
the trends?
for comparison from your report next week
Sure.
to this week.
Absolutely.
And I'm probably talking about what's in the purple on page 1 and maybe the first 3 bullet points.
Sure, yes, we
And
can do that.
I think that would be helpful to me.
Absolutely.
And I think that might give us an indication what's going on. We're still in Minnesota in a stay-at-home deal till May 18th.
Correct.
Right across the river, they're not, and maybe seeing some of these things, what these
Sure.
trends are.
Absolutely, we can get that to you.
It might be helpful to us.
Absolutely, yes, we'll do that. The good news is we received $25,000 more dollars from a foundation. Leslie has written, for the first funding I mentioned previously was $102,000, and she wrote another grant to a foundation, and they just awarded us $25,000. Now that funding is for the work with our homeless. So we're working with our homeless shelter, and of course we have a facility where we can place those that are positive, so those that are quarantined or isolated, those that have symptoms, and so that funding is for those intentions. So that's the good news, that we have $125,000 to work with right now. The numbers have been low in that facility, which has been good, meaning there hasn't been a lot of ill and symptomatic people in the shelter. So that's been the good news. So.
Well, I guess I look at the good news is you can say you got 125,000. I guess my questions have been, let's use it for testing people, you know.
Yeah, it's not, but
it's
again,
not working
remember, we can't test people.
I
So,
know
and we
you keep
can't
coming
use
back
it,
with that.
we can't use it for testing. It was specifically for the work that we would do with the most vulnerable population.
Yeah.
And that's why we were awarded, because they're the highest.
I understand what you're saying,
Risk.
Kathy, and
Yep,
I'm not disputing what you're saying.
right.
I'm just saying we've got money available here. It's $125,000. I'm saying, can we utilize it to test some people?
No.
And you say, no, we can't use it for that much. That's.
Right, yeah. We need the vaccine, and that's being developed, and typical vaccine for a virus is 12 to 18 months. They're talking about that being expedited. Be nice if we get a vaccine. You know, I talked about herd immunity before. If we could get 70% of our population vaccinated, we'd have pretty good herd immunity. We don't want 70% infected. We want 70% vaccinated. So more to come, but that's not going to be quick.
I'm more hopeful for a faster resolution to therapeutics than I am for a vaccine. As was mentioned this morning, the common cold is a virus, and
Right.
we haven't got a vaccine for that yet.
Right. We have, but influenza, we have a vaccine for.
Right.
And that's seasonal, so that's every year. So the more people we vaccinate, the better protected we are.
Just think of what that death rate would be if we didn't have a vaccine.
Oh,
for the flu.
exactly. That's exactly right. And this, with this virus testing or vaccine will be great. So I know the health systems are also looking at the antibody testing. I think you may have heard about that antibody testing. And that's really for, it's a blood test to tell if you were actually infected with COVID, and then looking at how your immune system responded. We still don't know what kind of immunity you will have.
It's that result that would ultimately give you a true death rate.
That's exactly right.
Right?
It usually takes about 4 weeks for that antibody to see how a person has responded to that. So we also don't know how long that will protect you. So more to come on that, but the health systems, I'm talking about Sanford and Essentia, when we have weekly calls with them, and they are hoping to be able to start doing some antibody testing in the future. It's not immediate. They have some things to go through yet for that, but that's a hope. So.
Well, this is sort of like roasting Kathy.
Yeah, I know. I want, Mr.
Anything
Chair.
else you want?
Mr. Chair,
Is there anything you want to tell us about the?
I know the National Institute of Health wants to study about 10,000 people that have not been tested for COVID to see how many had the virus. So that'll be good information as
That'd
well.
be easy to find 10,000 people who have not been tested.
Yeah.
Right here in
Maybe
Clay
we
County.
in Clay County. So, yeah,
Well,
more to come on that.
Kathy,
so.
as her chair just said, I know you probably feel like you've been,
Oh,
you
no.
know, put on the hot seat this morning.
Oh, no, I understand.
We appreciate the work that that you're doing. We understand that your hands are tied.
Yeah.
I, for one, will go on record as to say that I am disappointed with our state Department of Health and their ability to give more local abilities to fight this.
I have been in communication also with one of our representatives, so I'm keeping him informed of what's happening in Clay County. He reached out to me to just kind of have some conversations about that, so we're in communication as well.
Good.
So we'll continue to communicate, and I'll continue to communicate with Minnesota Department of Health. They're fully aware of my frustration, so more to come on that.
Thank you.
Any questions, anything else?
You probably don't want to tell us anymore.
Well, I think we covered quite a bit,
No,
so.
you didn't. Thank you so much.
Yeah,
Kathy.
Yeah,
thank you.
Kathy.
I mean,
By the way, are we having a press release tomorrow?
We're having a, yes, we're having a press conference tomorrow, and I don't know,
We haven't had any conversation.
Oh, okay.
Okay.
Because there's a town hall. The mayor of Moorhead was invited to have a town hall virtual meeting with one of the local stations for about an hour. It's actually this evening, 8 p.m. to 9 p.m. He just contacted me yesterday afternoon and asked me to be available for that. And he also requested that I reach out to a commissioner to be on that town hall virtual meeting. So, and
There you
that's
go, Tim.
tonight. That's tonight at 8 o'clock. And it's virtual, so I'm going to get, they were going to, what they did, I don't know if, there was a town hall meeting with West Fargo mayor. There was a town hall meeting, that was about a week and a half, or a week ago maybe. And then a town hall meeting with the mayor of Fargo. And so then they're wanting a town hall meeting with Moorhead. Now, the last two were just with the mayors. Mayor Judd wanted to invite a few more people to be part of that. So they're going to send that to this radio station to see if that's okay, that they have multiple people as part of that town hall. And so he just asked me to reach out to a commissioner to be available to talk about, the county, what's going on in the county with the process we're in. So that's tonight from 8 to 9. So I can be in communication about the logistics, but it will be virtual. If they can handle 6 people on the phone, that would be the numbers.
Sometimes when I watch the press conference and stuff like that, I don't know how much information is going out on those, when you read a presentation, you read something to somebody, and it's just, it's not giving out information to enough information to our people, what is it telling them, when you read something, we read it in the paper, we hear it on the news, and then one of us reads it, and it's just, I'm trying to find the benefit of that. I think it's great that they come out and tell us, what's going on and stuff like that, but are we getting to the gist of it, though?
Yeah, and it's as good as how many numbers of people are watching that press conference.
That's true, I don't even know how many people watch it. Yes.
Right, I'm not sure how many people are actually watching those, so that would be interesting to note. I can check with the Fargo, they host it, so I can ask the Fargo public information officers what kind of, do they know how many numbers of people are actually watching that press conference?
Okay. Thank you.
Okay, thank you.
Thank you,
for being
Kathy.
patient
Yeah,
with us.
thanks.